I always am scared of the invoices when I go to a private hospital. It's overwhelming, it's expensive.
I think our public healthcare system works great. Some of the best doctors in the country come out of the public hospitals.
Do you think that doctors are more loaded in urban India?
If a patient doesn't need a procedure, we will not ask for it.
Isn't that anti-business for you?
We are a public listed company. We don't have the luxury of running many negative unit economic businesses for very long.
Did you buy a company? Did you start from scratch? How did you design the product? How did you get actuarial experience? Because insurance is a complicated product.
Yeah. Mukul, are we rolling? Let's minimize movement. Hold on. Viren?
Welcome to the Barbershop.
Thank you. I notice a distinct lack of barbers, shaving equipment and sink, but okay.
But it is the new age barbershop.
Okay.
Let's start with you.
Yes.
Who are you and what do you do and what brings you to the barbershop?
Has dazzled the ancients for years. I mean, who are we really? But quick introduction. My name is Viren Shetty. I am the vice chairman of a healthcare group called Narayana Health. We are a publicly listed healthcare company in India. We run hospitals and we are making the transition away from being this place you go to when you're really, really sick and you need heart surgery or cancer surgery to becoming a healthcare company, which is a company that works with you to make you live your happiest, healthiest, longest lived life. And so a big part of the work I've been involved with recently is transitioning our company from heart surgery towards healthcare. And so what that means is we are building more clinics, we are getting into health insurance, we're doing online care, we're doing a lot of things, like you said, right? There's a conversation that people have with their razors in the bathroom that does not enter the common parlance. And just like with health, in most parts of the world, health is a deeply personal, private subject. Nobody wants to talk about it. If you're sick, you won't tell anybody. It becomes this thing of shame when it should be something we celebrate. Just coming out of COVID, where the whole world got together and decided that the global economy is not as important as everyone's health and well-being. And so let's shut down the economy, but let's take care of our health first. And so it shows where, as people, our priorities are, because at the end of the day, that's all you have. But we don't do enough to make it sexy or cool. We don't do enough to promote the gospel of good health when the things that you need to do to live healthy are simple. It's free. For example, all the snacks are looking at me with really, they're really calling to me. But with great effort, I'm going to try and control myself from...
You can have a makhana maybe.
Yeah, maybe. So why I'm on this podcast is to understand from entrepreneurs like you, where you're opening up the conversation of shaving away from just razors and blades to one in which you're taking it through the lens of entrepreneurship. I look at this as a thing of grooming and giving people confidence. And so for us, taking a conversation away from health being surgeries towards health being just confidence and vitality and life.
Is that paint the from to for me? When you say health was, when you had gone way past a tipping point and reached a place where a doctor had to cut you open and operate on an organ, to what you're now describing as almost preemptive lifestyle changes or preemptive lifestyle management so that you never even reach that tipping point, forget about going way past it. But paint that from to for me. And a follow-up question I have is, isn't that anti-business for you?
Yeah. So let's answer the second one about, is it anti-business to get people healthy and not in the hospital? Only if you're perfectly right and you're able to achieve it. But the fact is, this is a continuum, it's a journey. To put it in the way in which the startup world understands, the TAM is this big when it should be that big. Right? The TAM is people who know they have a problem, know exactly what it takes to have a problem, come to your hospital to get the problem fixed and have money to sort it out. So in the overlapping Venn diagrams of things where they intersect, it's this much.
Very
that
small.
is your TAM. Health is everyone. Health is for everyone. And we want to be a company for everyone. So it's not, a market depletive measure or something that will shrink revenue. No, I think if you build awareness, if you stand for more than the products and services that are available in your marketplace, I think you become synonymous with an entire category. And that you've seen time and time again for other companies that are really well known and have dominated their industry for decades. They stand for more than their products. So I don't believe that it would. But how do you get from X to Y? This is, and it's not a personal experience, this is the experience of anyone in this country where you had a family member who fell sick, where, or if you've read in the paper, some 40-year-old was exercising in the gym or doing a marathon and then they just dropped dead. Or you say someone, oh, they just got cancer, they were so young, what happened? These are common. And on the one hand, there's nothing you can do about it in terms of if God decides it's your time to go, you will go. But in a world where so much technology is available to you, where you can screen for all of this, where you can get checkups done, where a simple blood test, a simple and non-invasive scan, and simple lifestyle interventions for things that Indians are more susceptible to can lead to outsized improvements in your overall health. It is incumbent on anyone who has a responsibility to their family to take this a little bit seriously. So the same seriousness that every Indian parent takes towards beta padho, don't waste time, don't do drugs, don't do alcohol. If that even a little bit of an enthusiasm was transplanted to the kitchen where, less sugar, less all the other bad things that are available in the kitchen, less of that, I think we can transform into a much more healthy, productive society.
There's a lot of information about this. To an extent, I think an overload of information on preventive health happening all over the internet. I see, like, from influencers to journalists to the whole world has an opinion on what's good for someone's health. So it's clearly, I think you're right. I think in COVID may have kind of pushed this in mainstream in terms of people's consciousness. But do you think that overload is a cluttered market to kind of get the message through? Because there's no one size fits all situation, right? Like everything you like. My mom is a yoga teacher. She
Yeah.
will tell me 20 things to do to take care of my health.
Yeah.
Most of them right.
Yeah.
A doctor will tell me 20 more things. My gym instructor will tell me 20 more things.
Yeah.
And the 5 Instagram influencers I follow who look in great health themselves will tell me 20 more things. And by the way, I now know 4 founders in the last year. And that's just because they come on WhatsApp groups who have very tragically passed away, like you said, of just, a cardiac arrest, which was totally not expected. How do you distinguish the chaff from the grain on this? Like,
Yeah.
how do you build that out?
It's tough. And honestly, there is no easy answer to this. There's a world of unlimited content. And now, because of a lot of people pushing pseudoscientific, literature onto the masses and discrediting a lot of established scientific fact, most people are going anti-science and anti-medicine. It's not easy, but I would say that is why brands and companies exist, because that becomes a thing that we get into work and we try to solve every single day, us as well as you. And in fact, I would also ask you the same question, in that why trust one product versus the other? There are 500 different brands, right? There are 500 different opinions on what you should do. You build, at least for us, we think we position ourselves in a place of trust. And we say, what are the attributes that customers care about? They want trusted, verifiable information. And that has to immerse itself into everything that you do. The DNA of an organization has to be built around trust. And what is for us, that means we don't push anything that we deem is unnecessary. If a patient doesn't need a procedure, we will not ask for it. If a procedure costs a certain amount, we will not unnecessarily charge too much higher than that. We will give our patients exactly what they need at a price that they can afford. Whether you're extremely rich or extremely poor, we have a product that is able to offer you, and that's the brand that Narayana has built over the years. The hope, at least, is that it can translate into the content that we provide as well. That since it's coming from a place you trusted us for our surgery, maybe you trust us when we say, looking at the sun for 30 minutes in the morning will just damage your retina. It won't make you live a really long life. That's the hope, at least. But I don't know. Do you have thoughts on how do you stand out in a world that's just awash infinite amounts of content, most of it garbage.
How do you translate that, Viren, from your personal life? So it's clear that you are very thoughtful, and of course, kudos to your wife on how to live a good life yourself. You seem in good shape, and you are aware about this. Now, how does that translate into how Narayana's movement as an institution, from one that provided corrective measures to one that is now going into preventive healthcare and wellness in a larger way?
Yeah. The pandemic changed a lot of things for our business, as I'm sure for most people running businesses in this country. It showed us how vulnerable we are if you're just a single line of business and that business is just doing very high-end tertiary care. We were fine. We survived the pandemic in a way that most companies did not, non-healthcare companies did not, but it showed us how vulnerable we were. So that was the business imperative, that we realized that we had to diversify, we had to go upstream and downstream. When we recognized that this is something, even you take away all the emotion, you take the ethos, you take the motto of, if you have no empathy or emotion for doing good for customers, if you just say, show me the numbers, even the numbers would dictate that a healthcare company has to start looking more and more at the overall well-being of their customers. It's just a simple numerical fact. That's number one. Number two is, everyone working in our organization is getting to a certain age, and even you start to see all around you that we are not doing enough for them closer to their home. We do a surgery and they go right back to the lives that caused our patients to have that surgery in the first place. We do so much. We spend lakhs and lakhs for our customers to take care of them when they're really, really sick. When 10 years earlier, like a 10 rupee intervention could have helped them. So the cost benefit calculation, the ways in which you realize that we're doing a disservice to our customers, it just made sense for us to start moving. Maybe not all our businesses, not saying we close down hospitals or hospitals are relevant. Hospitals will always be relevant. But today it's 76% of our revenue just coming from get admitted to a hospital, do inpatient care. We think at least half. Let half of the new business that our company generates come from treating people at home, treating people online, providing basic interventions, coughs, cold, fever. Out of all of that, some of it may be preventative, some of it will eventually cause that person to think about us should any other bad thing happen to them. So it's a way to create that full vertical integration in the provision of care for our business.
And how have you started that? What are some of the service lines because I feel like the trigger for preventive healthcare in the customer is non-existent.
Oh.
Like, I will not go to a hospital or a doctor until I feel tremendous amount of pain
Yes.
to do it. So how are you creating those customer funnels? How are you creating awareness about something which is clearly so important?
Even for those who can afford in India, if you're wealthy, if you're of a certain demographic, or if you have insurance, Indians are the least likely to seek advice for something if they know they will live with the pain. We will do that. Even if you get advice, you're most likely to ignore. Even if you're given the medicine, you're most likely to stop taking it. That we are what's called healthcare avoidant.
Why is that? Do we not value our bodies? Like, why is that?
More philosophical queries. I don't know. I mean, if you want to...
Is India unique in that aspect, or are most human beings like this?
No, maybe it's sort of a Maslowian hierarchy of needs, in that, you're just 2 generations away from having ancestors who didn't have enough food to feed themselves, and where child mortality was 50%, infant mortality was 50%. We're not too far away from a time in which most of us knew struggle and deprivation. And so there's a generation that only thought roti kapda makan. Like, that's it. You take care of that, everything. There's a generation after that that said, no, just take one job and stick with it. Job security, that's the only thing that matters. Now, of course, we're lower middle income. We're developing, and so the sort of higher order aspirations start coming in. Previously, it was to live. Now it is to live long. I think when there's in between, to live well and then live long. So why we don't value? Maybe there's an economic argument to be made. Maybe it's just a question of this thing disseminating. But I think it's just a matter of time. Your grandparents, depending on how long they lived, would have never even dreamed of getting a knee implant. If they would live with that pain, they would just sit down at home and wither away, and not like all indicators for old age start to go down if you stop being mobile. You don't get out, you don't get fresh air, you don't talk to people, your mental faculties start to go down, and old age becomes a burden for you. Why? Just because you did not get knee implant. That's it. In a way that your parents, maybe if you do great amount of convincing, you can somehow convince your father or mother to get it if they need it. You would not think twice. If you're in your mid-60s and your knee wears out and the doctor says knee implant, you'll say, fine, tomorrow.
Yeah.
Your children will get it in their 40s, maybe proactively, because they'll be doing 10K marathons every weekend. So I would say that every generation we start seeking healthcare more. So anyway, back to the
part.
Yeah. So back to the original thing of how do you get there? How do you move from just emergency, really high-end, end-of-life saving sort of care towards more proactive, preventive? Now, the building blocks of that are pretty simple. It's just clinics, pharmacies, diagnostic centers, labs, building a network, building a chain. But everyone does that. But there's nothing to tie it all together. Okay, there's a clinic. Big deal. Why should I care? There's a pharmacy. Why should I care? We are the generation of send it home. I want it delivered to me. I want it even before I know that I need it.
Yeah.
Like opening up the Swiggy app and seeing the deals for all the things I've most ordered all lined up and ready for me. Healthcare can function that way. But we need a way to tie it all together. Now, we are a public listed company. We don't have the luxury of running many negative unit economic businesses for very long. Ours is a business where we have to show, profits.
Returns,
we our investors are patient with us, but not too patient. You will learn this one day, my son, when you become a listed company. So for us, when we incubate all these businesses, the clinic, pharmacy, lab, diagnostics, we can't just put it and pray and hope that someone shows up and turns these profitable. We had to create a forcing function.
Okay.
Which is, what is this thing that will make them fill up the clinic? What will make them come to the hospital? What will make them get the checkup? And I couldn't think of anything outside of a subscription model. And the only healthcare subscription model we could think of was health insurance. So we said, fine, let's do this other thing that we have no competence in. But we figure it is something that ties it all together. So since I have healthcare insurance or healthcare as a subscription, now I've flipped the equation. Now it is one in which I've taken your money in advance. That's all the money I have to take care of you. So I will choose the lowest cost intervention to keep you out of the hospital, because a 2 lakh rupee procedure for you, that's going to wipe me out as an insurer. Whereas a 20 rupee medicine that keeps you out of the hospital, yes, I'll make sure you take that. How do I make sure you take that? I will send someone to your house, draw your bloods. I will give the prescription to you. I'll deliver it home. I will make sure you lose weight. I will give you access to all the dietitians and physiotherapists and all the things that you require. I'll tie it into an overall health management package. And so I increase engagement with my customers. I keep them healthy. I give them what they want. Nobody wants the procedure. They want health. They want to, play with their grandkids one day. And that's how we thought about moving away from surgeries to this.
And so healthcare insurance and healthcare providing are very different businesses.
Yeah.
Oftentimes at odds, oftentimes, kind of together. How does an organization with the DNA of healthcare providing get into insurance? Like, did you buy a company? Did you start this from scratch? How did you design the product? How do you get actuarial experience? Because insurance is a complicated product.
It is. And it is something that we had no expertise in early on. We had to acquire all of that. So we tried to buy. We spoke to a lot of the health insurance companies, but they were on a very different trajectory and the DNA was very different. We invested in a health insurtech startup, again with the same idea, but they also had a very different idea of how to run the business. And so we had no choice but to finally end up building it ourselves. So that's the path we went down. Fortunately, we were supported very well by the regulator, who said, this is the sort of thing I want to see. I want to see an organization where the healthcare company, the hospital, and the insurer is on the same side of the table,
yes,
operating out of the same balance sheet. So that is the big difference. Normally, you're right, it is an adversarial relationship when I'm paying, but you're the one charging. That's adversarial. right? So it becomes a transactional relationship, which is what defines most hospital insurer relationships. But he said, no, let's put them both on the same side. Same balance sheet, you're paying money to the same people. So then I'm just paying as a customer. I don't care who I'm paying to. If I'm paying the hospital, I'm paying the insurance company, I'm just paying to this entity called Narayana Health.
Yeah.
And so Narayana Health's job is to take care of you for the amount that you've paid. That's the corpus. I've already taken your money in advance. You pay me for the next 10 years, I'll take care of you for the next 10 years.
Wow. Someone had recommended this to me on our interesting actually. I tried to get Ayushman insurance for my caretaker, and I realized that Ayushman insurance not leg- al- is not allowed for someone with income above 10,000 rupees in a metro city. So I had to get a private insurance, and then I kind of put it on the group saying, "Hey, looking for a private insurance for my caretaker. This is the profile. Any recommendations? Because doing it for the first time." And Narayana Hridayalaya's insurance came in very high, highly recommended at that time, and this is like probably a week back.
Unfortunately,
This-
we're not in Delhi yet, but we
so
will
then,
be.
so then I said, "Is this a Delhi thing?" And they said, "No, you'll have to go to Bangalore, or I'm like, "Oh, okay."
So the only way we can make this work is if everything runs in overlapping circles. So the only way we can, so our insurance for at the lowest price is 10,000 rupees a year for a family of four,
Okay.
right? Which is quite affordable. A lot of a family of four,
And what does
10,000,
that cover? Like what?
all the surgeries.
Okay.
There is some discounts on medicines, some discounts on medical care, but all the surgeries taken care of.
Cancer, everything.
Everything.
Okay.
Maybe not transplant, like the things that are very, very rare and odds of it happening are very less. No. And a lot of elective cosmetic type procedures. No. But most of the things that are going to bankrupt you, taken care of. And the only way we could make it work is by making sure, at this point at least, we control all the providers, meaning it's where all our hospitals are.
Correct.
We will roll it out in Delhi in 3 to 4 years. We will, because we have 2 hospitals here. We'll have more by that time. But the idea is that all of them work in concert. The clinics work with the hospitals work with the insurance company, and they're all working together to provide a unified front to the patient.
And do what is best for the patient.
Exactly.
How do you make sure that the incentive? So are the team now? This is very interesting for me. Where do the teams roll up together? Because the customer facing is probably, I'm assuming from a experience standpoint, has to be very similar, because I have so many stories of is it prepaid? Do I have to get it reimbursed? And the insurance will have to like check it out, and 20,000 documents are required. So I'm assuming you'll have to have a common front or a unified front face for your consumers. But at the same time, incentives are not always, in fact, are conflicting between the provider and the insurer. So how do you manage that as someone who's running the business?
Yeah. So they are two separate teams, and they are two differently regulated entities.
And two different CEOs and everything.
Two different CEOs and everything. In the end, they do roll up to me, and so I have to be responsible for both sides. Everyone gets it. The people on ground, they get it. Even people working in insurance, they don't feel good about the things that they need to do. But that's just how the incentive structures are aligned. Right? They get paid based on whether it's claim denials, they get paid based on making a certain combined ratio. As hospitals, the doctors and the management, they're paid to charge more and to. So everyone's doing as per all the things they want. But the DNA of our organization has always been one where we will use all our efforts and all our work will go into making sure that we make things more efficient, reduce my cost, and pass it on to the customer. And only our organization could have done this, because any rational hospital would say this doesn't make sense. You're leaving money on the table. Any hospital would say there's enough business to be made charging insurance companies an arm and a leg. Why would you willingly charge less? See, 10,000 is one of the lowest priced products in the market for what we're offering. But for us, we've always had a long-term view. Like I said, the TAM is only this much. It can be so much bigger, the market that we want to test. That is, people who are not getting healthcare. And when you grow the market, these things will take care of itself. So, on an individual, yes, just mathematically, these things are challenging. We'll deal with it as it and when it comes. But everyone who works for us, starting from the leadership, all the way down to the absolute line level, to the person answering the phone calls or to the receptionist, they all know that it's their families. They are the ones who are also buying this plan. And they'll be recommending it to people they know. So everyone has bought in to the idea that we're not here to deny claims. We're here to make sure that you're taken care of.
It reminds me of an experience I had a couple of years ago. One of my McKinsey colleagues was a COO or CEO at one of the leading private hospitals in Delhi, and I had a horrible backache. Wherein, like, I cannot tell you, like, it was shooting down my right leg all the way
Yeah.
to my ankle, and I was bedridden, and I was like, just get this pain out. I had no idea why it happened. Just
Yeah.
kind of gradually increased, and I was fairly active human being playing football. I think I must have hurt it in some way. Anyways, so I called up my friend and I told him that he's like, you need to see a neurologist with an
Yeah.
with an orthopedic bent, one of the best in. Now everyone knows a doctor who's one of the best in India.
Yeah. Yeah.
I've noticed this, like, so, and so I was like, okay, cool, but this is the CEO, so he probably knows.
Yeah.
And he said, you meet him, I'll get you an appointment today afternoon.
Yeah.
So my mom and I went,
Yeah.
and he basically did some tests on my legs, and he saw my right calf, and he said, your right calf is waning compared to your left calf. We have to operate your L4 L5 and fix the disc. And my mom is a very wise woman. She looked at him and she said, do you not need to see an MRI on this? And he said, no, I have way too much experience and it's going to work.
Yeah.
And we'll get it in. It's a 1-2 hour procedure. He'll be fit and fine. And I was like, you take a chainsaw to my torso, man, but get this pain out of my body.
Yeah.
I was in that situation.
Yeah.
And we did all the pre-surgery tests and got an OT booked for the next day. And I came back home and my mom was very skeptical. She just call up your friend and tell him that this is the update.
Yeah.
I'm going to get surgery tomorrow. Just let him know that. Thank him for this. And I did that. I called him up and I said, hey, man, thank you so much. It was within a few hours of your message, I have an OT booked for tomorrow. He's like, do you want to get a second opinion? I'm like, dude, are you not the guy who runs the hospital? He didn't know. I know, but I suffer from the same thing that you do, and I would not advise a surgery at all. But I'm like, you're not the doctor, man. He didn't know. I know, but I also know how these incentives are aligned, and you should go and, like, here's another McKinsey friend who who runs a hospital, and you should go and get a second opinion. And I went there, and that doctor said, no, man, the symptom is worse than the pain. Let's do physiotherapy for 2-3 weeks. We're going to put 2 injections to get rid of the pain. And after 3 weeks, if you still don't recover, we'll relook at this. I was so upset. I was like, this is going to hurt. And I was like, how? I couldn't believe that I could be taken, that the information asymmetry could be such a big deal that someone could actually go into my spine when it was not needed. I recovered in 3 weeks, man.
So the hardest conversation around this I have with my investors, because our average realization is half that of what the popular, and from the best hospital it's 1/3. Because
You use the word best very selectively.
the best, the one the investors love the best, we're like 1/3 of what they make. Yeah, the average patient pays us 1/3 of what they pay the best hospital.
I can see why.
Because the consult was 500 rupees, and the surgery would have been, if L4 L5, he's doing spinal fusion or he's putting implants.
He was going
Both,
to take something out, like the nerve.
that would have been like 2-3 lakh per procedure. So that's the difference. So I had the same thing. All the things happened. The difference is my father was standing behind me like a hawk, and the doctor just said, lose weight.
Yeah.
That's all. That's literally it. It just said, lose weight.
Yeah.
You fat little boy, just lose weight. Your back pain will be fine. Okay.
There's a physiotherapist in Bangalore. In fact, I think you should meet him. His name is Dr. Muthu. And he runs this spinal pain and rehab center in Bangalore, in fact. And another friend of mine from McKinsey, Suraj, told me just talk to Muthu. He got me out of the wheelchair in the most brutal way, but it worked. He made me go to the gym and all of that, and it worked. And I called up Muthu, and on Zoom, he looked at me, gave me 5 exercises, and said, just look at my face and do these 5 exercises 3 times a day, and we'll look at your movement every day for the next 2 weeks. I was fine, man. And after that, I'm so conflicted because I have such respect for what doctors do in India.
Yeah.
from the hours they put in to the kind, like I just see people in my family, I see friends who just go, like especially during COVID, put their life on the line
Yeah.
with, honestly, the economic reward for a doctor is just so badly,
Yeah,
it's not great,
for
it's
the
inequitable.
time that you're putting in, like it's just not
Yeah,
like there's
and
so
it's,
many easier things you
yeah,
could do.
right. And but at the same time, there are experiences like this, which is not rare.
Yeah.
After now, every time I've shared this with someone, everyone knows about the incentives and
Yeah.
everyone knows about. And sometimes I just wonder whether that's just the reality of
It's not I mean,
how do you solve it. Like I don't think everyone can build up
no, I
this kind
mean,
of DNA, which is let's do insurance and let's do this and let's
no, that's
do
hard.
have a
It's a
long view.
very, very hard way to solve the problem. In fact, a lot of the work that we have to end up doing in our organization is keeping things under control. Telling doctors that, do less. Don't be too aggressive. Structure the incentives properly. Fill in the medical records so we can check and see that bad things are not happening. Weed out the bad performers. But I can absolutely see a world in which, see, in this particular instance, if the doctor had no faith that you would get better with physiotherapy, and it's quite possible,
Yeah,
it could have
absolutely.
been a nagging, he'd be right.
Yeah.
Right. And in his experience, it's most likely is that, people who sit long hours, who have bad posture, who, generally don't take care of themselves, it doesn't get better with physiotherapy. And then you'll be back. So in a way, the doctor is saying, look, I'm just saving time.
Yeah.
Like I have a lot of work to do. I need to do this efficiently.
He said the same thing. He said, you're an entrepreneur, you're 35.
Yeah.
You need to get back on the road quickly.
Yeah.
If you were a 70-year-old person who was retired, I would tell you to do physiotherapy and take your time. But you have better things to do. So let's fix this and move on. That's exactly what he said.
Yeah. So there is a world in which that doctor's right. And in fact, in countries like the US where they studied this, they found generally the indications for a lot of spinal procedures are not really clinically indicated. That's putting a lot of the onus back onto your customer, but that's a question of whether you trust the person enough, whether the patient themselves will. See, one of the hardest things my father has to do these days is to tell people the surgery is not required.
Oh, really?
It used to be that when he started his career in India in the 80s, you had to really spend a lot of time convincing them, no, the surgery will help. Because back then, heart surgery was almost like a death sentence because the outcomes were so bad.
Yeah.
And the survival rate post heart surgery is very bad.
Yeah.
Now, because everyone's gotten so much better at it, the medicines are so much better, that people are more comfortable with the idea of getting, your chest cut open, getting things done. Whereas if you tell them, no, you don't need heart surgery, you have to take care of yourself. Take the medicines, lose the weight, change your diet. A lot of people say, no, I want the shortcut.
You also see your friends recover, right? You see friends, family members live far more fulfilling lives. You're like, hey, I want the shortcut.
Yeah.
Interesting. Talk about the institution. We've spoken about you and we've spoken about where you want to take Narayana, and it's such an interesting thing to kind of be. How long back did you enter the insurance space?
Oh, this was very recent. It was only last year.
And that's one big push that you've made at a strategic level. And what else beyond the hospitals? I hear you talk about clinics, kind of teleconsultation, stuff like. What else? What else in the wellness world are you doing right now?
This would be it. I mean, a lot of these things have a lot of moving parts, and there's a lot of things we need to put in place. A lot of this has been post-pandemic when we did a big strategic shift and we decided to change our company towards one that just does surgery, towards this thing we call integrated care. Integrate means all things working together. The moving parts of this are fiendishly difficult
I can imagine.
because being able to track a patient from a pharmacy to a clinic to a doctor's office to a lab, back to the doctor's office, maybe to the surgery, then to physiotherapy and at home and home delivery means you need a single source of truth. And most hospitals have software systems that each of these are designed as a separate interaction. So if I'm buying, your shaving cream, I am invoice number 4568 bought shaving cream on Monday. If I buy shaving cream next month, I'm invoice number 51269. The two, nothing is linked. There's no intelligence involved, not that they need to be. In the end, the two things are non-correlated. My need for shaving cream one day is not related to my need for razor blades the next. But in our business, it is, because a person who came with, say, blood pressure, and if that same patient came and showed up to, let's say, the diabetes department, the dietitian is really going to want to know
Yeah, what happened?
what happened over there.
Yeah, I agree.
And so the information needs to flow. And for that, we needed a really robust tech platform, which we've been building for the past nearly 9 years now.
Wow.
And we're the only large hospital in India that has a homegrown end-to-end tech system. Because without that, none of this would have been possible. I wouldn't have been able to dream of doing insurance and clinics without the ability to make sure that it's the same person I'm treating, and it's just all the interactions linked to that one person. It's not 12 different transactions. Because otherwise, the back-end reconciliation that you have to do to track and make sure, which is what US hospitals deal with, mountains of paper and mountains of paperwork and manual filling and calling people and dialing. You'll never be able to scale that sort of business in India unless you're able to have a longitudinal view of your customer. So it's not as sexy and it's not really patient facing. It's something that enables us on the back end to be able to really offer the care that we do at the price that we can. Because we know for a fact where you went, when you went, and at every place when you saw the doctor, how much the consumables were, how long you spent with that doctor, what advice was given, what prescription was written, was that fulfilled by us, was that fulfilled somewhere else?
So that patient will probably have maybe over a 2-year period, even for something basic, like let's say 2 health checkups and maybe 2 or 3 times where they have kind of come in for a consult, uh, would probably meet maybe 30 people in the Narayana ecosystem. And each of those kind of get logged and kind of create like a blueprint of that patient.
Yeah. So, right, it's still a work in progress. It is still quite chaotic in that there's just a whole lot of transactions that are happening in this unmediated way. Eventually, we want to move to one where everything is protocolized.
Okay.
Where it's not that you, Shantanu, show up and say, I'm of a certain age, I need to meet the heart specialist because my family has a history of heart disease. No. It is one in which you, Shantanu, are our member. And before your 40th birthday, we will call you and say, boss, time for this checkup, time for getting all the tests done. And for that to be a process where we guide you through the entire thing. Because right now, in this patient-mediated process, you're right, you end up you're like a ping pong ball. You just keep going back and forth, go here, get this test, go speak to that guy, speak to this person, okay, go back to the original person. That ends up being a very chaotic thing. And I can understand 100% this is why people hate hospitals. They hate it because you have to spend nearly a whole day there. Not only do you have to drive all the way, fight for parking, when you're in, you don't know where any department is, and every doctor is telling you a different thing, and there's so many tests that you need to do, and you can't even understand what half of those things mean.
Yeah.
It's a very, very difficult, indecipherable system with literally its own language.
Yeah. It's overwhelming. It's expensive. I always am scared of the invoices when I go to a private hospital. I like for my caretaker or for someone who I don't know exactly what's going to happen, because that, like, they enter and I'm in the waiting room because I've kind of just come as an attendant, and when I'm going to go to the billing place, I'm like, okay, I have no idea what's going to come out of this.
Yep.
There's no productized, like, I thought about this. In any other retail environment in the world, I would know beforehand how much I'm going to spend. Even if those spends are, let's say, not by choice, I have to do them. Like if I have to take a flight I would know what, I would have a choice and I would know how much it's going to cost. I'm going to stay in a hotel, I would know. I'm going to buy anything, even a home, like I would know. But in healthcare, like I have no idea how much it's going to cost. You're right, it's overwhelming. Information asymmetry is difficult, and I can only imagine how much harder it gets in larger government hospitals where the crowds are multifold.
Yeah.
And tech, I think, is the right answer, man.
Again, still very much work in progress. I mean, tech is only as good as the people using it and the ways in which we use it to drive the outcome that we want. But you're right, it does help us a lot internally in trying to find out the areas in which we are inefficient. We know a lot of the places that get choked at certain hours of the day. We can address that. We can deploy resources more effectively, but it still doesn't change the overall asymmetry problem, which is you coming in unclear what your shopping cart is going to look like
Correct.
when you enter a hospital, and then it may be just 2 items, it may be 20 items, it's unclear, and you're forced to pay for those 20 items, because if not, you may die.
Correct.
And so that's the issue with this. And so for us, if we're able to turn those into a series of predetermined fixed cost transactions, I can turn your healthcare into a subscription, then the contents of the cart shouldn't matter. It's like Netflix then. You binge all you want. You binge as much of healthcare as you want, as long as you're moving towards a thing where instead of spending 10 lakhs in one go, you spend 1 lakh over 10 years, or 10,000 over many years.
Do you think AI will be, you're clearly someone who's kind of ahead of the curve on tech. You think AI will be a massive boost in terms of just clinician bandwidth at the very least?
See, I think a lot of people are projecting what AGI can do and pulling it forward in the future and assuming that, okay, a super intelligence, if that existed today, then sure, it can do all the things what everyone thinks an AI is supposed to do. But right now, it's pretty dumb. So the current set of capabilities are a good adjunct to an already existing tech platform. So for example, medical coding. Medical coding means the ability to write down what a procedure is and what its related code is. Code is the way in which you identify what this procedure is.
Yeah.
That is a brain dead work. Someone has to actually read through line by line and do it. So an AI is pretty good at, it's just pattern matching. It can figure out that, okay, fine, these are the codes that apply for this particular procedure. Or voice transcription. Some AIs like Whisper and so on are really good at transcribing. A lot of doctors hate typing, so AI is really good for that. So it can help the doctor be so much more efficient as it stands right now. If you're talking about AGI, the artificial general, the computer god, maybe. But I don't know if we'll ever get there. If we do, I'll worry about it then. But normally AI applications are very useful, provided you have a strong enough tech team and a robust enough tech platform that's feeding it good data. If your tech is very weak, if your APIs are going to break, and then you try and get a really expensive, OpenAI model to sit on that, you're just going to cause yourself a world of hurt.
I agree with you, actually. I agree with you because I think there's a tremendous layer of judgment, and currently it might, but the speed at which this is transforming is quite insane. And actually, another thing with AI is which someone told me was that we don't want people self-diagnosing too quickly, and AI is going to give a lot of people even more tools to do that.
I mean, most people self-diagnose. Nearly everyone comes to the hospital once they run out of options earlier on. First you ignore, then you try some homegrown remedies, then you Google. That is happening anyway. As much as it may happen more, but it's not something that clinicians are unused to. That is people self-managing. So it's not too much. Not that people self-managing is a worry, but it's not. It's something that's already happening.
Talk about healthcare in India. We spend 2 to 3% of budget, depending on a good year or a bad year, on healthcare. So it's clearly something that the government and the taxpayer is depending on private practitioners, whether it's large hospitals and chains like you to the private clinic in a neighborhood, to kind of take the load of healthcare outcomes. We have a country that is clearly, and you rightly say, we ignore our health issues. We have massive penetration of cardiovascular and diabetic instances and cases in India. We are becoming unhealthier more and more so. Where do you see this going? Like, I see this as a very morbid, almost kind of view, because like 15 years back, we prevented HIV from becoming an epidemic in the country. At a government level and at a society level, we eradicated polio in the last century. But now I think we are again in a situation where our cities are a lot more polluted. Our food, water, and air is questionable. We are having people have 1 in 5 heart attacks are under the age of 40 now, right? So there are a lot of things that scare me, and I don't think we are spending the kind of money that we should be spending on healthcare at a country level, not only at an individual or a retailer, at a country level, on making this happen, and we don't care.
Well, let me ask you this, man. I mean, institutions being as they are, you think giving it more money we'll fix it. You take a startup with really bad unit economics, a horrible leadership team, and you've seen so many instances of companies just fold no matter how much funding they raise, because at its core, they never got their act together.
Correct.
Money wasn't the limiting factor. It's not, honestly, like money will help, but not as much as fixing a bad system.
Say more about that. I would love to know what like just define this, because think of me as, and our audience probably is just equal like me, as just being a distant observer and once in a while participant in the healthcare system.
Yeah.
But having clearly seen cases of a family member or a friend who has gone through it and kind of come out of it in a bad way. But talk about this broken system and like just break it down for us.
Yeah. And see, as morbid as most people's healthcare experience is, I would say that it is both. I don't know, maybe it's John Maynard Keynes or Feynman or some smart fellow said, you have to, the way you get to genius is to have two opposing views and hold them both to be true and evident. All the things you described, how bad it is, how we're getting sicker and adopting Western diets and eating all the bad things, and we're stressful, pollution-filled environments, it is bad for us, yes. But the opposite is also true. We're recognizing more and more as a country that these are bad for us. The interventions available are so much more. The medicines are so much better now. The surgical techniques, the diagnostic tools available are brilliant. So both things are true.
Okay.
That all the problems are worse than what they were and the solutions are way better than what they were. Now, this is not a money problem on an overall, it is a money problem. Obviously, in India, all things in the end boil down to money problems, but a system in which, say, the way in which everyone pays for healthcare. And the way that, let's say that you said Ayushman, the government, a government-sponsored program that pays for procedures done. You tell me what the bad incentive you've already put in place. If you're paying for incentives, if the incentive is to pay for procedures, you will get procedures.
Yeah, you'll maximize on that metric.
You know that story about when the British first came to India, they
snakes,
saw the
right?
snakes and they said, oh God, there's so many snakes everywhere, kill the snakes. And the Indians said, no, I'm not going to kill the snake. They said, fine, I'll give you 1 rupee for every snake head that you create. And then all the snakeheads started coming, and they started coming in larger and larger numbers, and they looked and said, oh, people are breeding snakes and giving it to them for 1 rupee. They said, okay, fine, we're taking it away.
Yeah.
And then all the people who were raising the snakes in cages, okay, screw this, and threw the cages out. And they had more snakes than what they started out with. So we are smart people. You pay for a thing, you'll get that thing. And so in the government's own data, huge numbers of hysterectomies are done on men. A hysterectomy is the removal of the uterus. Yeah, it's done on men. Now, how do you square that? It's not done.
Yeah.
There are no things. It's just that when they did the reconciliation of the Aadhaar number or whatever, that ABA ID, against the procedure code, they found actually a lot of these belong to men. So how could you get hysterectomy? So it means that if you're paying for a procedure, you're getting procedures. And a lot of those procedures are ghost procedures. They don't exist. And if you think, oh, India corruption, blah, blah, blah. No, it's not just India phenomena. Medicare fraud is many, many zeros more than whatever the fraud in India is. So throughout the world, healthcare groups find ways to go around the way a structured setup is. So you're paying for surgeries, you get surgeries. So that is clearly a broken system. So more money, if you say I'll put more money to Ayushman, you'll definitely get more hysterectomies on men. You'll definitely get more sort of procedures on patients that don't exist. Because there's more money to be made. That's what you end up with. You say, fine, I will change the incentive structure. You'll create something similar to what we've created. Again, whether it's integrated care, sometimes it's called HMO or Health Management Organization or value-based care, where you say, I will take this radius. I'll say, okay, who are all the providers in this radius? As I say, 10 kilometer, 5 kilometer radius. And you say, this is the population in that place that's living. These are all the providers. You guys get together. Here's a pool of money. I want you to cover. So if you say only the poor people, say 40% of them are poor, and I'm willing to spend 5,000 rupees per person per year, 10,000, whatever it is, I don't know. You guys here, take this money, sort it out. If you can figure it, whatever money you say, that's yours. And suddenly everyone's like, oh, great, now, and tell everyone that these are the guys you go to and you have unlimited access to the care. And so you've tied up everyone's incentive. So I'm not saying we should do that. I'm just saying there's an example in which you look at what you want to drive and you create an incentive structure around that, one that not necessarily money is meant to solve. I think our public healthcare system works great in some instances. And I think that some of the best doctors in the country come out of the public hospitals, but they are very tough places to work. It's not very remunerative. There are a very lopsided structure. So in a lot of the public hospitals, the nurses are paid very well,
Oh, really?
but the doctors, their payout is capped. So that doesn't make sense because a lot of the value ends up, while the nurses work very hard, yes, and they should be paid well, the gap that a doctor makes compared in the public sector versus private sector is enormous. And a simple cost benefit calculation from the government setup will say that, if I spend so much on infra, and some government hospitals have thousands of crores worth of infra that they've put up, it does make sense to underpay the talent, because then their output will be limited only to what they believe it's worth, and they spend most of their time outside in the private sector, if they join you at all. So then you rationalize it. If I'm trying to save thousands of crores of infra capex, then my OPEX needs to go up by a little bit more. It's
Correct.
just a few doctors, and you just need to triple, quintuple, or 10x their salary. But now they're full-time for you. They work their ass off because now they're being paid enough to afford a good house and stay in a nice location, and they won't have any incentives to go around. So there are enough systemic interventions that can be made. If you want to improve healthcare in India, you start in the public sector. The private sector can take care of itself. They should not be involved anywhere close to public healthcare.
Correct. Completely agree with you. So that's one. And what about talent itself? Like, do you think there's a dearth of, and again, people talk about privatization of education. It's a very complicated topic, right? Private versus government. One thing I love about medical colleges is that the professors, people who are teaching, are practitioners. I did my engineering from NIT Nagpur and my business school from IIM Lucknow. One of the biggest grouses I had was none of the people who taught me were practicing even 1% of what they were teaching. My engineering professors, and I was in good school, the engineering professors were not engineers. They had never worked in a company which had engineering at its core. My business school professors had never done a minute of management or business or entrepreneurship in their lives. They were good academicians. But with medical colleges, I love that the college and the hospital are kind of so close by, and people who are teaching are also practicing and vice versa. So that's great. But from a private versus government, from a the different kind of boards, the amount of time many doctors who I meet, they say, I'll never let my child become a doctor. It's too long. It takes away the prime of your life. The rewards economically don't make sense for most. For some they do, for most they don't. And it's too grueling, and it's also depressing in the long term. So, what's happening to that profession, and how is education shaping up for doctors?
So I didn't do medicine, and not because my father said don't do medicine. I saw my first heart surgery when I was 9 years old. I looked at it and I said, okay, but no thank you. Whereas my brothers looked and said, yes, more, much more of this.
So how many siblings are you?
There's 2 boys and a girl. There's 4 of us in all.
Okay.
My brothers are doctors. They all work in the hospital. My sister works in our nursing college. She manages the foundation.
Okay, but is she a doctor? No. So you and her are not doctors, and your 2 brothers are doctors. Okay.
So I'll defend a little bit when people choose to become doctors, and I'll say why it should be a good thing for you to do. It's hard, obviously. I mean, I would say any profession is hard, but medicine, of course, is a different kind of hard because it's physically grueling, as is a lot of other fields that you can do. Economically, I think the physical effort to reward you put in, it may not, there are other things you can do that can make more money for less effort, but you'd have to be in really the top thing. If you look at in the US consistently, we don't have good data in India, so I can only have US data, but consistently in the top 20% of earners who have consistent earnings, the highest number of mentions are around doctors.
Yes.
So the doctors occupy large numbers. So you get a very good median salary. That's number one. The other reason why choosing medicine is still a great thing to do is because you have a medical degree is like a visa that will get you a job anywhere you want in the world. You can work in some of the best countries, you can travel, your skills will always be required. It is a non-cyclical business. You never hear of a doctor going hungry and not having a job. You'll always be gainfully employed. Correct. It's like what people used to think government jobs were. That this thing you go and you'll always be taken care of. And it automatically puts you in a higher level of respect. See, the best doctors invariably come from deprived backgrounds, come from smaller towns, who have that sort of hunger and fire and are willing to put in the hard work and the effort what it takes to both escalate their earnings potential as well as their station in life. So it puts you in a very different station. So medicine is still, I would say, one of the great equalizers that is available to a lot of people. But yes, it is tough. It's tough to get in. There's very few medical seats available. It's the medical entrance exams, exit exams. It's really hard to crack. It's still something that's very gated. For an institution like ours, you asked about the talent management and how we're able to attract. See, we've been in business 25 years. If by now we still have problems attracting doctors, then we've done something really, really wrong. So while it is a problem for the industry, it's not so much a problem for the top 5, 6 hospital groups. Obviously, more doctors will always be better. It's easier for me in Delhi. I can get any number of doctors I want. It's much harder. I start going down the road. I go towards Sonipat. I go towards Jewar. I go towards, the middle of the country. I'm just not able to get. There are doctors there, but not enough doctors to create an adequate pool of supply. If one doctor leaves, the whole department has to shut down. So, yes, there are challenges for sure. But you're right. Medical education is a lot more rooted in the practice of it. So one thing my father keeps saying is that medical education should not happen in classroom. There should be no classroom. It should be just start treating patients. The curriculum component should be something online or something you can read after hours, but the actual work should be practical based.
Understood. And is that the reason why, for example, India is remained a place where the world comes to get treated? That that Indian doctors, not only do we have healthcare facilities that are extremely affordable at dollar level, but also that Indian doctors are just so much better because of the volume of cases that they've seen, that their pattern recognition abilities are just through the roof. Plus, it is not a litigious industry like US. The healthcare system in US is litigious to the bone, right? Here it's not. So the ability for doctors to take risks and to try things that might be slightly uh, out of the box just because they feel like we need to do everything we can to save someone, which is something in the US, for example, they wouldn't do because it could attract litigation. Do you think that's a fair way to put it? That there is that promise that attracts the world also, and is that an opportunity?
There's lots of points in there, so I'll try and unpack that. So India is a destination for lots of people coming in from really, really poor countries. That's the one thing. It's not that people are coming from France or Germany to India for treatment. It's mostly poor countries. Bangladesh, Afghanistan, used to be Iraq, smaller. So, and they have no options available. The minute they have options available in their home, they'll stop coming here. But it doesn't take away from the main point that Indian doctors are some of the best in the world. Again, I am biased. Of course, I would be. But I would agree that we're the best because we have the work ethic. We have the culture of, really going above and beyond. And ours is always a service-oriented society. Any number of economists will talk about how, we're skipping the manufacturing and moving straight into services. And this is not how a country should grow. Whereas I personally believe that, no, I think that's just natural to the way Indians are. We are naturally much better at services and at taking care of people and doing things that involve just working with our, minds and our hands. So I would say that, yes, Indian doctors are some of the best. And more important than any of that, if you adjust for purchasing power basis or whatever sort of adjustment you want to make for our economy being weaker than other advanced countries, for the quality of care that you get in India, the price that you pay is the lowest in the world. You can do any analysis you want. You can compare us, forget about US, Europe, all of that. You even compare us against Thailand, against South Korea, against countries that are much more nearby and have as good and as competitive healthcare systems as ours. The cost for the highest quality of care is the lowest in India. And so this is a great value destination for really high-end care. People should come. In fact, a lot of NRIs in UK do come to India for treatment because they know and they recognize that. And even we have enough and more stories where UK doctors will say, why are you getting it done here? It's so much cheaper to get it done in India and so much faster. So they recognize that. So yes, this is the destination for healthcare, for very advanced levels of care. And invariably, it ends up being attractive to patients that come from much poorer countries. So we have a very robust dynamic healthcare system, but still not enough. We have to fix payments. We have to fix the access. We have to fix the fact that we need 10 times the number of doctors and nurses, technicians, hospitals than we currently have.
On that last one, I actually wanted to ask you this. Do you think that doctors are more loaded in urban India and less loaded in... And the moment you average out a statistic, you lose the meaning of that statistic, right?
Yeah.
So doctor to patient ratio in urban India, I think is adequate, but in rural India...
Even doctor to patient ratio is meaningless, because what doctor are you talking about? Just because you have an MBBS degree doesn't make you a doctor. Most
Correct.
MBBS degree people aren't practicing medicine. A lot of them have moved on. They're working in other fields. Sometimes the lists are not even updated, so you don't even know how many of those people are alive. And the field keeps changing. So we have acute shortage of pediatric oncologists, acute shortage of neurologists. At one point of time, it's not true anymore, but for the longest time, there were more nephrologists, Indian nephrologists working in the US than Indian nephrologists in India.
Wow.
Just in absolute numbers, not as a percentage or anything. It's just absolute number of Indian nephrologists. Now it's changed, of course, but for the longest time that was true. So yes, in that, don't go by the overall statistics, there's still huge shortage. Fortunately, this can be addressed because it's just education. We're good at that, and there's enough people, and we want to learn. We're hungry to learn. You can fix that, and the doctors have very long careers. The medical field is one of the few fields you'll have. Very few others are there, like law, chartered accountancy, where 40-year-old competes with a 50-year-old, competes with a 60-year-old, competes with a 70-year-old, sometimes competes with the 80-year-old for the same patient doing the same case. You don't see that in a lot of professions. So doctors have a lot of longevity, and they have very long careers. So the gap can be addressed, and it is being addressed very aggressively by the government, and will keep getting better.
If you were in charge of healthcare in India at a government level,
Yes.
what are the 3-4 things that you would do?
That was the time I used to indulge these sorts of fantasies, thinking that, if only I were there, I would just wave this wand, I would do this sort of thing. So when I started out in this, working for my father part-time, this would have been 20 years ago, I would go to him for, these industry conferences, I go to meetings. I met this one health minister. I mean, he's long dead now. Long back. He was least bothered about his job. He didn't even know what his job was. Health ministry back then was a punishment posting. He didn't want to be in that room talking to my father. He just had such a sad expression on his face. And my father was telling him all the things he had to do. He said, "Acha, theek hai." He left. Then, after that, my father was part of the planning commission and in the national, it was called the NRHM, Rural Health Mission. This was the thing that was there before Niti Aayog, and gave them a lot of good advice on how to improve the doctor, improve the nurses, and generally they listened. And a lot of things have been taken to heart, but so many challenges, so many challenges that there's always the ideal, like every engineer, which I am, will want to say, I can engineer, I can fix and find this perfect solution, but it always hits the ground of reality. So the thing about 3-4 things, in an ideal scenario, I would have said, okay, number one, this Ayushman program, that money is going all over the place, take out all private hospitals from it. Give Ayushman money only to government hospitals. And patients now will start exerting choice. And so government hospitals will get this additional source of income, and then they'll start competing with each other to offer better services. They get extra money. They'll pay doctors better. So, that seems simple, but of course, there'll be so much opposition because so many doctors groups, so many vested interests are there now who will say, no, you have to include the private sector. So it's just, ideally, that would be like one thing I've always thought. Why is public money going to the private sector? It's not. There's enough of a government hospital that would need that money. The other is, this is something my father's campaigned for many years. It's slowly happening, but it's taking a long time, where the medical field happens in 2 stages. One is your undergrad, your MBBS, then you specialize. And actually, you even super specialize after. It's actually 3-4 phases sometimes. Okay. But the way it works in India is that at the undergrad level, there's a lot of seats, and there's more being added. But there's a real constraint in the super specialization. And because the field has moved so much towards super specialization, people in MBBS are basically useless. It's like a B these days. Engineering basic degree, you can't really do much. Today, without your PhD in machine learning, you can't even call yourself a programmer, right?
Correct.
The medical field is sort of like that you need to specialize. And those are very few. So you should make that actually more than the number of undergrad seats. Why? Because the foreign countries are damn smart. US, UK, Germany, all these guys, they keep the specialization seats much higher. Why? Because they know not all the things are going to be filled by their population. Our own people we lose to those countries who go, because they can't get a seat here. They'll go over there. they learn, they train, they work in those systems, and then we've lost them forever. So we spent all this effort educating them up to age 22, only to lose them because those guys just had more seats. That's a ridiculous imbalance that has to be addressed. So that's one thing. So if we also increase and do what they do, then we can start getting, other country people coming and training in India. So that would be the second thing I would do. Third, what else? It's a waving magic wands all over the place. I would make health insurance mandatory. I think that in this day and age, you can't walk around without insurance. It's too risky. It doesn't matter even if you're 30, 40-year-old. Tomorrow you just die. We see so many instances where the family is just like, you think things are going well for them, and then the breadwinner dies, or they get debilitated because of some condition, and just straight to poverty.
Yeah.
2/3 of rural poverty, it may not be true anymore, but for the longest time, 2/3 of rural poverty came from healthcare related bankruptcy, which is you weren't able to work, you spent too much on you weren't able to farm, and suddenly you slipped into below poverty lines. So insurance, I would say, has to be mandatory. Any kind of, whether it's government insurance or private, but just there has to be mandatory insurance.
I completely, and insurance is such a complicated product, and so hard to understand. And in India, we have done, I think we have done a pretty poor job of confusing an insurance product with an investment product, especially on life.
Yeah.
We have done a poor job with educating people on exactly what you spoke about, which is just downward migration of economic strata because you fell sick for 2 months, or your life savings were, you have to take a loan to pay for surgeries, and it was just there was an easy product out there. Which could have
As long as I'm waving wands, I will put in the education ministry also. I would say your math curriculum, the minute you reach calculus, you stop. Nobody needs calculus. From that point onwards, only teach financial literacy. Just accounting, balance sheet analysis, how to calculate interest rates, insurance, how to read actuarial tables, how to understand an EMI.
Yeah.
Like that, you use calculus.
You don't need it.
And we waste, millions of hours of our children's lives on that nonsense.
Talk about what it was like to build. I know you kind of touched upon it with the Canara Bank and ICICI anecdote, but talk about the early days, watching him as a child, and then of course coming into the business as a second generation in the business, and now kind of growing it in your own way.
So my dad grew up in a really small town called Kinigoli. This is in Mangalore. It's in coastal Karnataka. It's from Mangalore. If you head towards the airport, you'll pass by. It's one of those villages just off the highway. You just blink and miss it, and you'll just pass by. You won't even know. His father ran restaurants in Bombay. Those are the Udupi restaurants, because we're from Udupi, and so all people in Udupi, there's few avenues that you can do. Either you can sit on the land, or you run a dosa sort of place, or you become an engineer or a doctor. Or in those days, you got into crime. A lot of people from Udupi got into crime. They're all been, their lineage has been extinguished now.
Clearly, because decision making that was faulty.
So my grandfather on my father's side was entrepreneurial in that sense. He started the restaurants, and so you can say maybe that gene existed, but I don't think the word for that existed for my grandfather on that side. That's just the only way to be, because there were no people like that, did not get government jobs, they were not educated. And so he was very clear that all his sons get educated, either engineer or doctor. So my father said, okay, become doctor. And everything, on the one hand, you can say there's divine providence and something that, you always had a vision and this is what you want to work. Or on the other hand, you say, no, you just kind of lucked into each and everything. And it's probably both, right? He knew he wanted to be a doctor. He knew he wanted to be successful because he didn't know any other way to be. I've met a lot of people, but the number of people I met with single-minded focus, determination, the ability to actually match execution with all the things they say, there's very few people in the world who can do that. My father is one of them. So, gone to medical school, and then from there not just medical school. He didn't just say, I want to be a doctor, I want to be a heart surgeon, which was the best kind of doctor you could become at that time. And there's no place to train here, so he had to go abroad for training. So he went to the UK. And as long as he was there, he was doing as much work as he possibly could and taking all the opportunities that he could. Again, always with the idea that he'd want to go back and do something in India. But again, not entrepreneur. Again, the word, he didn't even understand what it was. He just said, I'm a doctor, I work in a hospital. Who has a hospital that can hire me? He asked around, they said, nobody's hiring. Okay, then he waits one more year. Then he asks his friends again, are there any jobs? Is anyone hiring? No, nobody's hiring. Okay,
This is in India.
This is when he was in the UK.
In the UK.
He was working in the UK, but always looking for opportunities here. Then finally, one of his patients who he operated on in UK, turns out they were from this really big industrialist family and they were building a hospital in Calcutta. They said, you come and you work and you run the whole place. I said, great. Where is this? He said, Calcutta. Oh, okay, fine. Never been to Calcutta, never heard anything about it. Just knew it existed. So he said, fine, pack the whole family. I was 5 years old at the time. You go to Calcutta. And that's where he started his
So
career.
your first 5 years were in the UK, is it?
My first five, actually no, I grew up all over the place. So I was born in Bangalore. Then when my father was in UK, I would be with him for some time. Then my father was working non-stop and my mother got bored. So she would go to the US to stay with her sister. And then, I spent a little time in the US also. I enrolled in kindergarten there, then back to the UK. Then sometimes the holidays I'd be in Bangalore. So I don't really know what my first 5 years of life were like. I just knew it was all over the place.
Until Calcutta happened.
Then Calcutta happened. So that was 1989. And he worked for someone. And he was given a position of the medical director, chief cardiac surgeon. And he was able to grow that institution. He put the team together, did all of that. But again, with a great degree of control. For him, it was very clear that he's not one to look for an easy life. So he got other high performers to come work for him. And all the people who were not high performers couldn't last 10 seconds under him. So they would naturally go out. That's the sort of team that he built up. Ones who were very clear that we're going to change what it is. So waiting lists are very common. He said 0 waiting list. I'm going to stay till 10 o'clock at night if required, but I'm going to see every single patient, which once he set that pace, a lot of the doctors simply had to match it. So he worked much harder and he spoke really well to the patients. And so he developed quite a fan following. My mother got really homesick. She wanted to move back to Bangalore, and Calcutta is a place you don't speak the language, and it's hard for South Indians to stay in East India in those days. So he moved to Bangalore, but again, he had in his mind that, okay, fine, I'm going to do my own thing, because the set of opportunities that are available when you're working as employee in someone else are only so much. So again, how do you create those opportunities for yourself? So I guess I have to build my own hospital, but how do you do it? And so my mother's father was a very wealthy industrialist and he ran many, many businesses. He had one factory at the absolute edge of the city, which even by today's standards is the absolute edge of the city. And he said, okay, fine, there's some land in front, you build a hospital there. So they did. And so they built the hospital, and my father...
How many beds was the first one? Like rooms?
150 beds. It was just in Bangalore, the edge of the city. In Calcutta, also, the government gave him some land for free. The one IS officer just came on and said, just sign this paper, I'll get you land. Father didn't even bother asking where it was. He just said, fine. So they allotted him land. And it was only when we got there, we realized why the land was coming for free. It was a swamp. It was just fully submerged.
Okay.
Fortunately, he knew, this another big industrialist family who ran coal plants, and coal plants generate a lot of fly ash.
Correct.
Fly ash is a waste. He said, fine, you're going to throw that anyway, give it to me. So dump all of that into the swamp and just make it not swamp. And so, like in Calcutta, we begged, borrowed, stole, and just somehow managed to build another 150 beds.
On the swamp area with fly ash on it?
Yeah.
Wow.
Again, in phases. So everything was bootstrapped in a way you cannot believe.
Okay.
In Calcutta, someone would donate 10 lakhs, someone would give bricks, someone would come and say, fine, I'll, put up the building, you pay me later. In Bangalore, again, so my grandfather built the building, but he rented it out. And so from day one, you had this 15 lakh rupee bill that had to be paid no matter what. My grandfather's many things, but, being strict about his money was one of them.
That's why he was wealthy.
Yeah. Then again, my father had to work his ass off to generate patients in 2 hospitals now. Well, previously he was just in 1 hospital.
And 2 cities.
2 cities. So again, I never saw much of him growing up. I just, heard stories and legends. And if I wanted to see him, I had to go to the hospital to see him. And so that's how, from a very early age, I got to spend a lot of time in the hospital. In fact, after school, I'd be dropped off in the hospital. In Calcutta, before we got our house, our first home for 6 months was the hospital. One of the wards was converted into our house.
Really?
I've literally grown up in hospitals. So
Wow.
2 hospitals he had to start with when we started NH. This was in 2000, one in Bangalore, one in Calcutta. He's just spreading himself really thin, running back and forth between. But it paid off because at that time, so much demand was there. And we were offering something at a price that most people found to be much lesser than what they would pay if they went anywhere else. And we're doing very high-end heart surgery. So it did well. And so we were able to pay the rent and then just kept expanding from there. Some people donate money or we would just borrow from banks, and banks in those days were a lot more, they were easier to get loans from. If you came in as an entrepreneur with just dreams in your pocket, they said fine, we'll back you. So it's a very different environment now. So in a way better also. I think a lot of the entire VC ecosystem today resembles a lot like what project finance used to look like in the 90s and early 2000s, where they'd back entrepreneurs and they won't see. In the end, they had assets to acquire. If we couldn't pay, they'd have taken the whole business and they'd have taken our house also, because these were 100% collateral. So I would be homeless, but they managed to make it work. I hold him up as this example because I've spent so much time working under him and seeing him, that so much of what he is and his lessons and the way in which he runs his business is synonymous with the ethos of the organization. And that's something that not just me, you talk to anyone that works in a company, they've heard stories, they've heard legends, they just know the idea of what it means, what NH stands for, what Dr. Shetty wants us to do. And so every day we're working to live up to that. So whatever we do, whether it's building tech, building clinics, expanding overseas, it is all, does this serve the mission? We wouldn't do a thing if it did not serve the mission. We started dental clinics once, very high-end aesthetic dental, because we thought there's a great market opportunity in that. And we did it, and it did quite well. Until my father asked, is this serving the mission? Is this something that we want to be seen as doing very high-end aesthetic, cosmetic type things? We said, actually, no, it doesn't really fit square with the mission. I said, fine, just sell this business. We shouldn't spend any time doing something that does not fit with the strategy. So the sort of company we built up. And so the entrepreneur's journey it's tough. I'm not saying that, it was easier back then or it was something that automatically made sense. We had a lot of challenges. We kept running out of money. The financial controls were atrocious. We had to get equity funding at some point, and they brought in some series of discipline to the company. Then we had to become a publicly listed company at some point, and that brought another level of discipline. We didn't know how to talk to public markets and investors, and that brought another set of skill set. Then we realized we've expanded too much, and we're not, we're spinning around in circles. We're not running a good business. So we had to, again, reprioritize. You have to learn how, this is just, you look at it from the inside, it just looks like chaos. Everything is spinning in circles and everyone's running around like their hair is on fire. Our organization just looks like constant chaos, and everyone from the inside, they're just wondering where. But if you look at it from the outside, over the luxury of people looking from outside, looking at the scope of what we managed to achieve in 25 years and all the things that we've been able to do and the impact we've had on society, and it looks like, yes, this looks like a great planned vision that was executed perfectly.
I agree completely. Talk about this chaos a little bit. Talk about the journey from 2 hospitals in Calcutta and Bangalore, the chaos that led to, kind of making the business a lot sharper, raising equity capital for the first time, working with investors. Talk about the chaotic moments and how your father went from being, someone who was doing surgeries and treating patients day in and day out to also now kind of dabbling with making sure rents and salaries and, financial statements of now a clearly fast growing business. How was he able to understand that? How do you professionalize in a way? At what point?
Well, the good news is he never bothered understanding any of that. That was everyone else's job. My father's job is to set the vision, and all of us need to, he's like that, the Eliud Kipchoge is just running so far ahead of the pack, and everyone's just struggling and panting. How do I keep up with this guy? He's the fastest man in the world. He can go hours and hours. So, no. One story I remember, we had this this finance manager who joined us after working in a PSU bank for many, many years. He was actually the guy who sanctioned our loan. And then he was due to retire, and we said, you're quite good. Would you like to join us? And then he joined and he went like that. Oh my God, what did I got into? Like I gave these guys money and now I can actually see how this thing is being sorted. So it became his problem to fix.
That
Um,
was a
he's-
smart move to get him in.
he was the first guy who introduced me to the idea of discipline and the fact that accounts need to be squared. I was still in school at that time, but in my family, you're not allowed to be idle.
Okay.
And so if I had free time, they go to work, go somewhere, just don't be at home, just go work. So I'd go, I sit in his office. I don't know anything about business. He would show me the numbers. He would explain to me, see, this is how much we're spending. This is what your father wants to spend. This is how much we have. This much money. I'm telling your father we only have this much money because if I tell him we have that, he'll make me spend it on adding more and more buildings. So he brought, at least for me, brought in the concept of what now it's called unit economics, but back then we were doing more of a day-to-day accounting system to find out if we just broke even by the end of the day, because our business was fully cash-based back then. There was no insurance, there was no credit, no government business. Everyone's paying cash. And so the vendor management and being able to maintain inventory days and all that, you had to sort of reconcile it on a daily basis. So chaos, everything is chaos, and then you slowly start tightening up a few things and the chaos just moves to another direction. It never, if you're in growth mode, it never goes away. I don't even know that it should go away, because if it goes away, then it means you're this very well established, stodgy. It's like, at the center of the earth is a molten core that's always exploding and there's lava flowing and it could explode anytime and there'll be volcanoes, but it's alive.
Yeah.
Right? And that is what causes the tectonic plates to move. And that inner fire that's inside the earth is what causes seasons.
Yeah.
And it's what causes rain. And it makes life happen. Right? So things are always alive. It's always chaos. It could kill you at any point, but it's what makes things move. Whereas you take other planetoids which have a fully rock core. Nothing moves there. Those are called dead planets.
Yeah.
It's like nothing exists because there's no
No
fire
energy.
and there's no energy. There's no chaos. So it just becomes
Such a
stable.
good
and
analogy. That
yeah.
is such a good analogy.
It's a little bit of too much science fiction-y analogy, but so the chaos just moves somewhere else. So in terms of what forces you to take your shit seriously, with nothing other than when you are forced to. When there's no money in the bank, when the banker would be outside your door tomorrow and saying, pay back the loan, that gets you real serious, real fast.
Yeah.
And so the sort of financial discipline came because we had no choice, because we had committed ourselves to a path where we will treat patients at a really low price and we'll do high volume. It meant that you had to really keep track of your numbers. And so numbers, first it kept track in Mr. Rao's ledger. He was the finance manager, and slowly moved to Excel files, and Excel files to Oracle, whatever those things are. Because we had no choice. If we didn't, either we had to fudge the numbers or we'd have gone bankrupt a long time ago. Then how we go the path of becoming a professional services organization, again, no choice, because we were at a point where banks were no longer able to fund us because we ran out of collateral to give them. Then the only other option back then was private equity. And private equity are
Serious suits.
VC ke baap. They're the guys that taught you think VCs are bad. No, they're wonderful, wonderful people. I have a lot of friends in private equity. They're salt of the earth. But they definitely are a lot more serious about their business and generating their returns, and thus you have to be a lot more serious. You have to then start making business projections. There were hospitals.
Who were the P guys who gave it?
We had AIG and JP Morgan. They were two massive, massive companies and brought a lot of discipline in place. Yeah. So previously, my father wanted to do something, he would just call up the finance team and say, do it. If he wanted to take up a land, build a building, he would say, do it. And there's an entire organization that comes together and says, okay, fine, this is how we do it. We get this contractor from here, we get this money from there, we conduct the survey, and that's how it got done. But now you get someone who asks, why are you doing this?
Yeah.
And because I want to is not a good enough explanation. You say, okay, make a business plan. You say, what the hell is a business plan? And then they sit and explain, a business plan means you have to go and project out. And then we got another young finance guy, so he'll go and, okay, fine. It means you want me to fabricate some numbers of the future. Okay, I'll fabricate numbers for you. So make some made up numbers and show it 10 years. They'll say, okay, fine, go ahead. And you think you've beat the system until you're in year 1.
And they ask
Sorry,
you,
your numbers do not match up against the made-up numbers. And they say, what happened? Oh, you actually want me to deliver on those things that I said I'll deliver? They say, okay, let me give you a new business plan. So we'll revise the business plan, but the new business plan is also made up numbers. You bought yourself 1 year of time. And then you get to year 2, and then, okay, it seems you've not delivered on this set of numbers either. Then you start learning, oh, wait, I can blame someone else. So let's start making excuses. And then as management, you learn. The economic environment was not great in this quarter. Because of this particular reason, we had much less inflow of patients coming from this part of India. So we think we can catch up over the next. And then you start getting management commentary in place. And this is how my education as a supervillain begins, you see. I start by learning at the feet of the greats of how a public company should be run. Anyway, eventually we got to a point where the PE guys needed an exit, and there was no other option but to become a IPO, a public listed company. Not that we ever thought we'd ever end up being there, but becoming a public company has been a great gift for us.
when was this?
2016. We were the first IPO of 2016. So we were so scared that our IPO would flop that my father didn't tell anyone that we were having IPO. We just kept a very hushed affair. But fortunately, I think we only had 30% oversubscription. And I think over the next 3 years, our share price just went like that.
Oh, really?
We listed at 250. It briefly went up to 300 something, but went down to 200 and just languished there for many years. We didn't know how to be a public company. We didn't know, how to tell our story, how to explain that, wait, why are those guys making so much more money than you?
Yeah.
Oh, no, because, we deal with, poorer patients and, there's certain, but, the other
is
hospitals
right.
also deal with poor patients. They deal with the large spectrum society. They're making way more money. Now, what is the right way to explain that they're doing things that are not necessary? What is the right way to explain that we're still a young company, we're putting systems in place? No easy way. And public markets are brutal.
Yeah.
And so they'll penalize you. And so then I said, fine, we need to act together. We need to start taking this stuff way more seriously, which we started around 2018, 2019. We started putting in place a lot of the building blocks, putting the tech in place and rolling it out. So it is a journey that's mostly been a series of cascading failures, none of which was sufficient to kill us. So every risk and everything that we did, we made sure that it couldn't end us. And that's how we're still here. Like, the only thing you can say is a kind of survival bias. That the only reason I'm still here talking to you today, because I survived.
Wow.
I wouldn't say
And
that.
all was driven by the ambition of your dad to just make sure that the best care, the most necessary care, in the most affordable way. Like, everything seems to just kind of be tied into that vision in some way.
You don't need anything else, man. You want to build a business, all you need to do is to say, I will work honestly, I will give customers what they want, and I will make sure that I'll give it at a price that they're willing to pay, and I will spend much less than what it cost me to make that product or service. That is
Pristine. That's it. That's simple.
that you don't. Everything else is narrative. Everything else is just fluff on top, and you can overcomplicate things. And why someone selling dosas on the road or a panwala can run circles around any IIT incubated set of entrepreneurs, because those guys, they understand first principles.
Yeah. Day
They
in, day
understand
out.
input cost. They understand my market. I put myself outside the train station. I price my chai at 5 rupees. Done.
Yeah.
And so they'd be unit economic positive day one. They'd be, running way better businesses than 90% of the startups you see out there. Get so caught up on TAM and figuring out, applications of AI in a business that doesn't require it.
Yeah, I agree. Completely agree. In Bombay Shaving Company, we thought being a D2C business was being a tech business for like 3 years. Before we realized building a website and creating a payment gateway is not tech. Focus on product, focus on brand, focus on a great consumer experience. Everything else is just enablement.
Yeah.
It takes a long time to figure basic stuff out. Until you articulate it, it's very difficult. So the fact that, And also, like, healthcare has seen tremendous private equity transactions and activity over the last 5-7 years for sure, right? Like
Yeah.
every large healthcare provider has seen
More than
activity.
that, I mean, private equity has been in this business easily 20 years now. They started with
I now
Apollo
see
to
this now every 6 to 9 months, like from Fortis,
see,
Vedanta.
invariably, our business is it's very capex intensive. There's huge amount of infrastructure. And when I'm saying healthcare, I don't mean like this other parts. I just mean hospitals to an
Provider,
extent.
yeah.
It's very capex intensive. So you have to build all your costs are loaded upfront, and then you get to amortize that over that many years, and you get to sweat those assets. So that is a model where at least the past couple of years, traditional lending is not able to fulfill because the cost of building all of this keeps going higher and higher. So equity tends to be the model that is most preferred because one, it doesn't have any with debt. It also means your cash flows get depressed, and ours is a business where the cash flows are important. So you need those upfront big, infusions, big slugs of equity, and invest it in something that you know will pay off. Using private equity to invest in a business where all the money goes into funding working capital and running expenses, that is the surest path to getting fully diluted out of your
Correct.
company. That's not the right way. If you're taking, maybe I could be wrong, but the thing is, at least my opinion is that equity should be used for creating assets that in the end become self-sustaining things that can pay off your investors tomorrow. Whereas if you're using it to fund working capital, that money is wasted because you've not fixed the main problem. You're not generating this machine that will provide a return. See, equity, they say, is the most expensive form of debt.
Yeah, I agree. Especially in heavy cap, that's one of my clients at Wicked used to say that, like, the easiest way to protect capital is build an asset like a factory and utilize it to 80%.
Yeah, that's it.
And that's it. I want to build a factory and make sure it's 80% utilized, and I'll protect capital and protect equity both.
Yeah.
How has it been for you as a second gen entrepreneur? You clearly, you're not a doctor, but you clearly are an extremely curious, intelligent person who's grown up in a hospital.
Thank you.
And I see this with second generation entrepreneurs who have, like, kind of where the first generation entrepreneur was just like, you use the word legend a few times, right? And that status kind of just continues independent of involvement in business. And there's always a halo or an aura, which is very good because the starting point is very different. But it's hard to deviate from a path. I always think it is high downside, limited upside. Like, even if you do well, people will say, hey, you had a
Yeah.
great starting point. But if you screw things up, people are going to really blame you,
Yeah.
and your dad will be front of the line, right? So,
Yeah. No, this is the
this is a very
worst.
difficult place to be. Second generation entrepreneurship is not as what people make it out to be. People think it's a silver
It's
spoon situation. It's not. It's really hard.
no, it's the worst kind of put option that you have. Um, let's see. One is you're born with such a chip on your shoulder in that I have to prove, I have to prove, I have to prove. And a lot of the people I've seen who are descended from successful people, either they run away from the challenge or they don't take it up or they wither under the attempt. But more often than not, a lot of them rise up to the challenge. My life has been so much easier than my father's or my grandfather's, so much easier than a lot of the other entrepreneurs who are starting out without any of the support. Because I have a platform on which. So I have to, it's enough to say that I have to prove I can do it for myself on my own without my father's help. That is just ego play.
Yeah.
That I could have taken that path. It would have been just purely self-serving ego. I wouldn't have achieved anything greater for society. I may have built the same thing. I may have built much less. Maybe I'd have built more, but the odds would have been greatly stacked against me being able to achieve that. But if I apply it to this thing that my father's created, I say, fine, there is a platform already. It can run well. It can run even better. And I'll apply my little, small engine to that already overpowered thing and take it places. And so that's the sort of path that I see myself on. I've long given up on the idea that, they say, oh, Viren, Viren does what's required. That's why I tell anyone who asks, what do you do? I do what I'm told. Right? I'm just here to keep the thing away from spinning off its wheels. Because the thing is, when you're powered by almost limitless ambition that my father has. The tendency is that then that sort of train goes off the rails from time to time. So it's my job to sort of push it all together.
Amazing. Viren, this has been such a fascinating conversation. From your insights on the industry to nutrition and just the way your institution is continues to be true to its mission. Uh, Wish you the very, very best for the insurance play. And I think it's got its heart in the right place. And I really hope that you're able to create a working role model for everyone else to kind of follow, because I think penetration of insurance is probably one of the biggest challenges for India over the next 10 years. And I really hope that you are at the forefront of making that happen. Before we let you go, uh, you know, people who are watching are maybe 23, 24, 25 years old, looking for inspiration to take that leap. They're on the fence. They're entrepreneurial in their own way, but you know, they're looking for that small, kind of spark inside. And if they're watching, like, what's the one thing you would want to tell them?
This is being an entrepreneur. It's, this, it's a hard journey, right? I know I don't have what it takes to be an entrepreneur. I know where my strengths and my skills are, and this is something I would never do. It is a gut-wrenching decision. It is hard. It is unrewarding. So just like I said, what people assume over medicine is a lot of work for no effort, a lot of work for no result. Entrepreneur, like 99% of startups fail. So it is hard. The advice I would say is, don't do this just because you saw it on Shark Tank, or don't do it because you think you can be the next, Sachin Bansal, or you can be the next, whoever the most successful exit founder is. Don't do it just because this is the archetype. Not every actor becomes Amitabh Bachchan. Not every startup founder has a successful exit. Don't do it for those reasons. Do it for your intrinsic motivation. If you're incapable of anything else, if you think you will, it's like oxygen. If you are you going to die tomorrow if you can't do it? Then do it, because then it is, there's no other way how to survive, to live. Then you'll find a way. You'll get enough mentorship. You'll put enough effort, because you'll have to fail and keep on trying again and again and again. So for us, the biggest shifts that has happened in the journey of entrepreneurship today has been celebrating the fundraise as a mark of success. For us, every time we had to go to the bank, every time we had to go to equity, was a point of failure for us, because it meant that our business didn't make enough money. So that switch has happened. So in a way, it's good that it's not celebrated as the failure that it is, but it does mean that the more you raise, the further and further away you're going from building a business that's able to sustain itself, which is in the end, the only business that lasts, a business that sustains. So it's a hard journey. There are enough people who help you. There's an entire ecosystem of people who help you on that journey, but don't do it just for the thrill of it. Don't do it just because it seems all the cool kids are doing it. It's hard. It's meant to be hard. It is rewarding. You can create a great difference in this country, but you really got to want it. I say this I speak from experience, because I know, not that I don't want it. Every day I dream, one day I'll set up my own thing. No, I just know I'll be really bad at it.
My personal view is I think you will be great at it, because I think people who have and I think about this when I see, for example, children in Gujarat who are in the store from the age of 7, 8 after school with their dads and moms, and the dinner table conversations are about the store and the balance sheet and the money and the collection, and they grow up with that and they study with that. I think they have a flex and a vantage point that is truly distinctive. And I think I don't think you give yourself enough credit. I think if you were to start something in the healthcare space, you will have seriously outsized advantage compared to everyone else.
See, you don't understand. I don't like being poor. So, okay.
Starting point to make sure that never happens.
I have kids to feed. So I'm not taking that journey.
Oh, this is amazing. I do have one more section that we asked folks who watch the Barbershop to send in some questions for you. So before we let you go, we're going to ask you some of those.
Yeah, sure.
Tanmay is asking, is there a way to enhance the growth of made in India medical devices? Do you see that growing?
It will naturally, but the thing is, it organically takes time. See, medical devices are only as good as the number of hospitals that are able to use them. And in the end, we are ruthlessly loyal to our bottom line. So you have something that has good quality and a good price, we will buy.
Okay.
And a lot of the low-end devices have moved away from, first it was US, then it was China, now it's all been moved to India.
Oh, really?
So it will naturally move up, and Indian companies are, see, in the end, that's the thing, right? It's what Adam Smith said about capitalism. It's not out of the goodwill of his heart the baker's making the bread, or the fisherman is going and catching the fish. They're all doing it to feed themselves.
Yeah.
So entrepreneurs see the opportunity that exists in the Indian market. So I would say that the way you make the medical industry grow is to have the whole medical industry grow. How you make the whole medical industry grow is by the whole sector getting bigger and removing all the barriers and increasing financing and funding and people buying insurance. So this is how, the larger sector grows. If short-term things, I would say that manufacturing is hard. It is something I have very little experience with. There are a lot of inbuilt challenges: labor, supply of power, water, connectivity, logistics. So I would say that a lot of those are slowly being sorted out with a lot of these SEZs for manufacturing and PLIs. It will take time.
Awesome. Amol is asking how to ensure the quality of prescription drugs in an institution. Because sometimes very cut down rates and tender processes lead to pharma companies that kind of create different tiers of the same drug. Sometimes dosages become different. Sometimes, they're not effective if they're at half the rate and 1/4 the rate. So I've heard doctors say that, with the branded antibiotic, the fever goes away, but with the unbranded one, 3-4 doses and it doesn't work.
It's a problem, though. We see, on the one hand, putting an effective drug regulator means that, yes, in a way, you do improve the quality, but then it does mean necessarily that the cost have to go up. So India is a place where, in a free market, you should have access to everything. You should have access to, chai by the roadside. You should have access to fancy Starbucks sort of things. So whatever you're able to pay. The problem, of course, is that you start lowering the price, the active component starts going down, and the doctors say it's just chalk. It doesn't even work. So there should be a minimum standard. So large institutions like ours were able to spend the time and effort to actually go to the factory and do random supplies and actually test all the molecules to see, if it's saying it's 5 mg of the active molecule, whether 5 mg of the molecule exists. And the doctors will very quickly be able to tell whether the fever is coming down or not. But a lot of the generics that are sold are quite spurious in some instance. I would say that, I don't want to come batting for the branded generics as against the thing, because then they'll say, oh, you're a tool of big pharma and so on. But it is a serious problem. I would say that in the end, trust the doctors who are writing the things in the large institutions. They have more incentive to get you well and out of the hospital.
You've spoken about moving from, and this is from Kanishk Srivastav. Kanishk is saying that a lot of hospital brands are moving almost 20 to 25% of their business to pharmaceuticals. And, what is your view on medical diversification within the portfolio? You have diversified towards insurance, but moving towards pharmaceuticals?
I think she means pharmacies.
Yeah.
Pharmaceutical means manufacturing.
Pharmacy,
Not just pharmacy. Medical treatment is a big part of overall healthcare. I would say we are moving away from inpatient care towards outpatient, because that's a natural evolution of healthcare, which is not just happening in the hospital, but closer to home, and tomorrow at home also. So our business is one where a lot of the further investment going forward will be to push more care out of the hospital, in the clinic, pharmacy at home, delivering medicines there, getting the scans done outside the hospital. So we want to move from, right now it's nearly 75-25 to 50-50.
Shruti is asking an interesting question. Do you think India can be a leader in healthcare research and pharmaceutical R&D, which requires massive funding and sometimes backloaded rewards?
We can. Now, to be the leader means that the amount of money, so what is research other than what you do with the surplus with the intention of creating another surplus? The thing is, we don't have a robust R&D ecosystem in India because our profit pools are so squeezed. A lot of companies don't have enough money to invest in it. The few that do, IT companies, for example, they invest a fair amount in R&D, but still not sufficient. So I would say that unless the overall profitability of this sector improves, we are far away. But it doesn't mean that Indian healthcare does not participate in R&D. In fact, Indian clinical hospitals are major clinical trial sites. Indian drug companies are plugged into a global network of drug companies that are doing research. And the more digitization that happens, the more we're able to start really tracking the progress of Indian patients. But simply, this is one thing that we need to get richer as a country. And so we'll be able to do more.
Amazing. People have A plus access to healthcare, but still succumbing
Because
to
access is not enough now. You have to, it doesn't matter that the hospital is right there. You have to go in there
Yeah.
and get the checkup, get the scan. See, anyone, see, even 40, a lot of doctors saying even that's too late.
Yeah.
Because Indians, we get heart attacks and much earlier in age. I got my full checkups done when I was 30, and I found exactly all the things that I will be suffering from, both from what they were able to tell from the lab test as well as looking at my family history. Like I've had uncles who had heart attacks in their 40s. So I know that that is a real risk and concern for me, so I take extra care for it. And a lot of people should.
Viren, thank you so much. Been such a pleasure to have you on the. I hope you enjoyed yourself, though.
I did. Thank you so much.
And thank you for spending time. And I really hope you open in Delhi very soon, because I think all of us will benefit tremendously from having you around.
Thank you.
Not only you, but also your services. But thank you so much.
Thank you.